10 habits that harm your kidneys and the signs that they are sick. Without kidneys, we cannot live. It is very important to take care of your kidneys. The ones you have now are the only ones you will have for your entire life. Kidneys are responsible for filtering blood, producing crucial hormones, aiding in mineral absorption, producing urine, neutralizing acids, and eliminating toxins. The constant damage and deterioration of our kidneys can go unnoticed for years because kidneys can still perform their functions with only 20% of their capacity. That's why kidney disease is often referred to as the silent disease. For kidney damage to progress to renal insufficiency or severe kidney disease, both kidneys need to function at only 25%. Therefore, it could be years before you realize that your kidneys are damaged. The lack of symptoms can lead to the development of a serious chronic kidney disease. That's why it's essential to be aware of the habits that harm your kidneys and the symptoms indicating that your kidneys are ill. But before we begin, we'd like to ask for your support by subscribing to the channel and giving us a thumbs up to let us know you're proud of us and that you enjoy the kind of content we're uploading. You can also leave comments with your thoughts and suggest future content to us. Habit number 1 that damages your kidneys: taking pain medications or analgesics unnecessarily for self-prescription. In a study conducted by the American Nephrology Association, it was found that 7% of people who had excessively consumed acetaminophen and aspirin had smaller kidneys with irregularities and calcification. There are also some medications that have potential side effects that can harm the kidney. Many people self-prescribe these medications and use them excessively without medical supervision. Medications like NSAIDs or nonsteroidal anti-inflammatory drugs, antibiotics, and some herbal products that contain potassium. Examples of NSAIDs include ibuprofen, diclofenac, naproxen, and naproxen sodium. Many over-the-counter medications like NSAIDs can provide immediate relief but can harm your kidneys if used excessively, especially if you already have a diagnosed kidney problem. Reduce the use of NSAIDs or pain relievers and never take more than the recommended dose. The abuse of pain control medications is a significant cause of kidney failure. There are medications, on the other hand, that have a potential negative effect on the kidney, but under medical supervision and when used for the necessary time and dosage, there is no problem in using them. Habit number 2 that damages your kidneys: consuming too much salt. Diets high in sodium can raise your blood pressure, which can cause kidney damage. Add flavor to your meals with herbs and spices instead. Over time, you'll find it easier to avoid salt in your food. Excessive salt intake puts an important extra burden on the kidney. Let's not forget that it not only controls mineral levels but also blood pressure. Blood circulation within the kidney is significantly affected by high blood pressure. Using a lot of salt in your food in the long term is a bad bet for your kidneys. Habit number 3 that damages your kidneys: not drinking enough water. Staying well hydrated helps your kidneys eliminate sodium and toxins from your body. Drinking plenty of water is also one of the best ways to prevent painful kidney stones. People with kidney problems or renal insufficiency may need to restrict their fluid intake, but for most people, drinking 1.5 to 2 liters of water per day is a healthy goal. Water intake helps your kidneys fulfill their functions, especially the excretory and regulatory functions within the internal environment. The ideal daily water intake is 2 liters. With less intake, the kidney undergoes unnecessary overexertion. Before we continue with the video, would you like to learn about a natural solution to kidney disease? It's a simple, natural, and holistic program with proven results. It's a powerful solution for achieving better kidney function and well-being. Click on the link in the video description or on the pinned comment link to learn more about this system. Habit number 4 that damages your kidneys: consuming many high-sugar foods. Excess sugar causes obesity, which increases the risk of developing high blood pressure and diabetes, the 2 leading diseases worldwide that cause chronic kidney disease. In addition to desserts, sugar is often added to foods and beverages that you may not consider sweet. Avoid condiments, breakfast cereals, and white bread, which are sources of processed sugar. Pay attention to ingredients when buying packaged products to avoid adding sugar to your diet. Sugar provides empty calories, which in itself is detrimental to the kidneys and implies a risk of diabetes and hypertension. The diseases that most damage the kidneys, people with diabetes, whether type 1 or type 2, must manage their condition very well because kidney function can be seriously affected in poorly managed diabetes. Habit number 5 that damages your kidneys: excessive intake of animal protein. Animal protein generates high levels of uric acid in the blood, which can be harmful to the kidneys and cause acidosis, a condition in which the kidneys cannot eliminate acid quickly enough. Protein is necessary for growth, maintenance, and repair of all parts of the body, but your diet should be well balanced with fruits and vegetables. The kidneys filter out proteins, so they should not be eliminated through urine. This involves significant work. If the intake is overly excessive, the workload will be as well. Habit number 6 that damages your kidneys: postponing the act of urination. There are people who have the very bad habit of urinating very infrequently throughout the day, as they suppress the sensation of needing to urinate. In other words, they feel the urge to urinate but postpone it. This is a bad idea from every perspective. It can promote the formation of stones, especially when other risk factors are present, and it also favors urinary tract infections. It doesn't cause them, but it does facilitate them. Urinary tract infections, especially those that reach the kidney, are something we should always avoid and treat properly if they occur. Habit number 7 that damages your kidneys: smoking. If smoking harms your lungs and your heart, did you know that smoking also harms your kidneys? People who smoke are more likely to have proteinuria or protein in the urine, a clear sign of kidney damage. Habit number 8 that damages your kidneys: sitting for extended periods and never exercising. Prolonged sitting is associated with the development of kidney diseases. Although researchers don't know the exact reason how being sedentary directly impacts kidney health, it's known that increased physical activity is associated with improved blood pressure and better blood sugar metabolism. These two factors are very important for your kidney health. Habit number 9 that damages your kidneys: not getting enough rest. Kidney function is regulated by the sleep cycle, which helps coordinate the kidney's work throughout the 24 hours it needs to function. Sleep hours not only serve to replenish energy but also to repair tissues and secrete some substances, among other things. Kidneys, like many organs, are more easily damaged when not rested enough. Habit number 10 that damages your kidneys: excessive alcohol consumption. Alcohol in moderation is not a problem, but excessive consumption is a very serious issue. Alcohol abuse involves consuming more than 4 alcoholic drinks per day. One of the organs that can be seriously damaged is the kidney, so it's important to consider that when consuming alcohol, especially if you already have a kidney problem, even minimal consumption can be a bad idea. What signs does your body give you that you have a kidney problem? Regardless of the level you're at, if you suffer from kidney disease, having awareness of it gives you power. Knowing the possible symptoms of damaged kidneys can help you seek the right treatment to improve your health. Most of the time, it's bad habits that are harming your kidneys. If you find that you or someone close to you is experiencing one or more of the symptoms listed here, consult a doctor for blood and urine tests. However, remember that some symptoms can be caused by other health issues you might be facing, not necessarily a damaged kidney. Never stop visiting the doctor to clear any doubts. Back pain, one of the earliest and most consistent signs of kidney damage or simply overloaded kidneys, is lower back pain. Sometimes it occurs on just one side, and that will be the side of the kidney that's having more trouble, but in most cases, shortly after the pain subsides on one side, it will move to both sides. A typical example is waking up in the morning or even in the middle of the night with lower back pain on one side or both. You may urinate, and it may or may not come out easily, but then your back loosens up a bit, and it feels much better. This is an early warning sign of kidney damage and is much more treatable if addressed promptly. Rashes, itching, and dryness. Kidneys help remove waste from the blood, so when they fail, the buildup of waste in the blood can cause rashes, severe itching, and dryness. This is often an early sign of kidney damage and should be taken seriously. Avoid the temptation to treat it with topical creams that do nothing to address the kidney problem. Changes in urinary function. Since kidneys produce urine, when they fail, your urinary patterns can change in color and consistency. Some examples of these changes include: urine may become foamy or bubbly. You may start getting up more at night to urinate. You may urinate more frequently or in larger amounts than usual, with pale urine. You may urinate less frequently or in smaller amounts than usual, with dark urine. You may feel pressure or have difficulty urinating. Your urine may contain blood. Preliminary changes in urinary function are moderate signs of kidney issues, with a change in color being a sign of more severe damage that should not be ignored. Swelling in various parts of the body. Kidneys remove waste and excess fluid from the body, so when they are not functioning properly and cannot perform this function, excess fluid accumulates. This often leads to swelling in the face, hands, legs, ankles, and feet. At this point, kidney damage has become much more acute and should be treated immediately. Fatigue and weakness. Kidneys produce a hormone called erythropoietin that helps produce red blood cells that carry oxygen. When you have kidney disease, levels of this hormone decrease, leading to reduced red blood cells in your body, resulting in anemia. This decreased delivery of oxygen to cells causes general fatigue and weakness and should be treated promptly. Certainly, what you've seen in the following video works, but it's only a piece of the puzzle. If you want to learn about a natural and holistic method with numerous testimonials to address kidney problems, click on the link in the video description. You'll be amazed. If you found this information helpful, don't forget to give this video a big thumbs up, share it with your friends, and subscribe to our channel for more health-related travel information like this. Stay healthy and happy, and remember, in the end, what matters is not the years in your life, but the life in your years.